Medicine has been advancing rapidly in recent years in the area of diagnosis and treatment. In particular, cell therapy is emerging as a new topic in the therapeutic field. Cell therapy is being considered not only as an alternative treatment for intractable disease, but also as alternative to surgical treatment for joint disease such as knee and shoulder problem. Today, I would like to introduce you about stem cell therapy being performed at our Osang Neurosurgery Clinic and Osang Stem Cell Center. First, I will briefly explain stem cell and focus on cell therapy using other stem cells from blood, bone marrow, and adipose tissue, which are vital in terms of safety. Stem cells are cells that play a role in healing and regenerating damaged tissue or organs in our body. And we all have a large number of stem cells. When a wound on the skin heals without applying ointment, or when a bone is broken, the fracture heals without being treated. These are all phenomena that occur because of the presence of stem cells. Since these stem cells are created in the bone marrow and move into the blood vessel to circulate through the body, the bone marrow is an important source of stem cell. This is why research using bone marrow-derived stem cell is the most traditional and has the longest history. However, recently, as it has become known, the adipose tissue is also rich in stem cells. Stem cell treatment and research using fat are becoming more active. In conclusion, stem cells are cells that play a role in my body's ability to repair and regeneration. Stem cells, when present in a large quantity and of good quality, it can play a key role in leading a healthy life. At Osang Stem Cell Clinic, we use the patient's own blood, bone marrow, and fat for stem cell therapy. I will briefly explain each of these. Normally, blood is collected from the arm, a venous blood collection, but in Osang Stem Cell Clinic, ultrasound is used to separate various components in the blood by collecting blood from an artery instead of vein. Cell therapy using blood takes about an hour and does not require fasting or anesthesia. Both bone marrow and fat harvesting also performed using ultrasound to find the area with the least vein, the safest, and the most stem cell rich area. In the case of bone marrow extractions, it is performed under local anesthesia on the skin of the pelvic bone in the hip area and takes about 5 to 10 minutes. It takes about an hour to isolate and treat stem cell from the harvested bone marrow. On the other hand, liposuction is mainly performed on the abdomen and is usually performed under sleep anesthesia, but sometimes awake liposuction also possible and it takes about hour. The process of isolating stem cell from the harvested fat and performing the procedure takes about 3 hours. To summarize again, a bone marrow stem cell treatment is performed under local anesthesia in the buttocks and take about 2 to 3 hours in total, while adipose stem cell treatment is performed under sleep anesthesia and take approximately 4 to 5 hours. Also, before stem cell extractions, bone marrow require fasting for 2 hours and fat require fasting for 6 hours. Various growth factors, cytokines, and immune cells can be isolated from blood, and mitochondria and exosomes can be separated from platelet concentrate extracted by blood centrifugations. Mitochondria serve as energy factory that produce the energies the cell needs to work. and exosomes are involved in the exchange of information and signal transmission between cells, contributing to the organic functions between cells. These various cell components are primarily used in combinations to treat symptoms such as chronic fatigue, hair loss, anti-aging, and menopause, and when used together with bone marrow or adipose-derived stem cell treatment, various synergistic effects are achieved. Bone marrow and adipose tissue contain large amounts of stem cell. In the case of bone marrow, there is an advantage in that there are various types of stem cells, such as hematopoietic stem cell, mesenchymal stem cell, and neural stem cell. In the case of adipose tissue, most type of stem cells are mesenchymal stem cell, but there is an advantage in that the number of cells is abundant. Depending on the patient or patient symptoms, bone marrow or adipose tissue-derived stem cells can be selected and performed alone or simultaneously. The following are indications for our clinic: chronic fatigue, brain fog, cognitive function impairment, improve hair loss and menopausal symptoms, improvement of diabetes, hyperlipidemia, liver function and lung function improvement, and chronic inflammatory disease, and shoulder, knee, cartilage, and ligament damage, autoimmune disease, for example, rheumatism, lupus, multiple sclerosis, bad chest, and Crohn's disease, and ischemic and hemorrhagic cerebrovascular disease, chronic degenerative central nervous system disease, for example, Parkinson's disease or Parkinson's syndrome, and etc. Stem cell therapy is usually administered intravenously, but in case of acute cerebrovascular and neurological disease, it may be administered carotid or intrathecally. And for musculoskeletal problems such as spine or joint, injections are directly administered to the affected area using imaging devices such as ultrasound or C-arm X-ray. In addition, for hair loss treatment, injections are sometimes administered directly to the scalp. It is usually decided after examinations by considering whether the symptoms are acute or chronic, the severity, the progression of the disease, or the patient's overall conditions. Some patients receive stem cell treatment in a single session, but if possible, we recommend 3 sessions once every 3 to 4 weeks for acute symptom lasting less than 6 months, and 3 to 5 sessions approximately every 3 or 4 months for chronic symptom lasting several years. It is recommended to avoid overwork and excessive drinking for about 2 weeks after stem cell treatment. In case of bone marrow, sometimes the extraction site may feel sore for 2 or 3 days, and in case of fat, depending on the amount extracted, abdominal discomfort may last for 1 or 2 weeks. Of course, there are many patients who do not feel any discomfort after stem cell extraction. If it is uncomfortable, we recommend taking anti-inflammatory painkiller for 2 or 3 days. We are one of the hospitals in Korea that has a large number of stem cell cases for cerebrovascular disease, other nervous system disease, and autoimmune disease. Because we have extensive clinical experience and operate our own stem cell research lab within the hospital, we can carry out the process of separating, banking, and culturing stem cells in a professional and systematic manners. Here are some of the distinguishing points of the Osang Neurosurgery Stem Cell Clinic. Various growth factors, cytokine, immune cell, mitochondria, and exosome can be separated from blood, which contribute to maximizing the effect of bone marrow or adipose stem cell treatment. Depending on the patient's symptoms, Bone marrow or adipose stem cell can be selected or performed simultaneously. Abundant experience in stem cell treatment for cerebrovascular disease, nervous system disease, autoimmune disease, and joint disease. The most important, maximizing the migration of stem cell from cerebral blood vessel to brain cells through treatment that opens the blood-brain barrier in central nervous system disease. This is treatment program called the exostem booster to maximize the effect of stem cell treatment. Treatment is performed once a week for a total of 5 times using exosome extracted during the process of isolation and culture of stem cell. This treatment takes about 30 minutes and can be administered either intravenously or subcutaneously.